name is Alyssa Rohr, and I am a freshman at Western Michigan University, class of 2018. My major is pre-occupational therapy, and I'm excited to embrace the career. Occupational therapy is an amazing and unique healthcare position, but not everyone knows quite what we do. It is important to understand that an occupation can be defined as an activity in which one engages. Occupational therapists work closely with patients, clients, and their families to create goals that are important to them. Occupational therapy is a health practice that uses goal-directed activity to promote independence and function. Treatment is individualized because people are unique. Therapy is often different between patients and clients. As occupational therapists, every day we encourage people to do something they may never have thought they'd be able to do again. Forbes rated occupational therapy the #3 best job in healthcare in 2014. Occupational therapists work with people at every age with all diverse types of disabilities, developmental delays, genetic problems, cognitive and mental disorders, trauma patients, and just about everyone else. An occupational therapist may work with infants, children in various types of settings, and even older adults with disabilities as well. Contrary to popular belief, an occupational therapist will not find you a job. What we will do is get you back to doing whatever it is you love to do by setting goals you place input and importance on. We work in hospitals, clinics, schools, personal clients' homes, and community service centers. One population that truly benefits from occupational therapy is in fact children. There are 6 emerging areas of practice in occupational therapy. 2 of these are needs of children and youth, and technology and assistive device developing and consulting. The Individuals with Disabilities Education Act, IDEA, of 1991 and its amendments in 1997 strive to improve educational chances for children living with disabilities. IDEA necessitates that schools educate students to their maximum potential in their least restrictive environment. OT can help kids with various needs improve their cognitive, physical, sensory, and motor skills and increase their levels of self-esteem and sense of accomplishment. Childhood is a time of growth and refining skills. Most believe that children do not have any occupation at all. What most people do not realize is that play is a child's occupation. Occupational therapists can assess children's play abilities, improvements in the academic setting, and overall everyday abilities. What is observed can then be compared for what is developmentally appropriate for the child's age. There are many disabilities OTs intervene with in school settings. Some of these may be mental retardation, hearing impairments, speech or language impairments, visual impairments, serious emotional disturbances, autism, traumatic brain injury, learning disabilities, neurological impairments, and developmental delays. There are many benefits to children in occupational therapy. Some of these include creating unique interventions to help a child appropriately respond to senses and stimulations, facilitating play activities that instruct as well as aid a child in interacting and communicating with others, identifying, developing, or adapting engagement in meaningful activities that enhance the child's quality of life, and reducing environmental barriers that limit a child's participation in family, learning, and community-based activities. Identifying needed assistive technology devices and supports, preparing the family and child for changes in roles and routines, educating the family and school staff on diverse needs of the child, enhancing social skills, development and leisure activities in the school environment, and assisting with school mobility, recommending adaptations, accommodations, and equipment. Occupational therapists are continuously and constantly learning information on new therapeutic techniques, interventions, and uses of new technology. There are many examples of occupational intervention techniques. Occupational therapists know how to watch for early signs of developmental delays, children who are falling behind or who may acquire an unknown disability. If an OT notices anything, we know how to intervene and prevent situations from worsening. There are many techniques and ways OTs may intervene in schools. Some of these may include advocating for lighter backpacks to reduce back injuries, creating multiple handwriting activities to observe signs of dyslexia, detect if there is a sensory disorder that prohibits the child to grip a pencil properly, or to assist in overall handwriting ability. OTs can also assist in fine motor skills and can also provide assistance by teaching children with something as cerebral palsy or just a speech problem how to better communicate with others. Occupational therapists will be very creative in designing activities for children. This will enhance the child's interest in working with the OT and in the activity itself. Children who are in therapy overwhelmingly admit they enjoy working with an occupational therapist because there are always fun games or crafts they can do on their own. Occupational therapists create therapeutic relationships with their clients and patients. We are skilled at communicating with various types of individuals and are aware of the uniqueness among children. All children should have access to occupational therapy services. The outcomes and quality of life that ensue are unlike any other end result children may have based on school involvement alone. In the future, occupational therapy may make all the difference in a child's life.